Hello, everyone. Glad you're here. I'm excited to introduce to you Melissa Moore, who is an exercise physiologist with Wake Forest Baptist Health in High Point. And she has got some wonderful information to share today about exercise, the importance of exercise, and how important it is for cancer survivors to do some type of exercise. And if there's one type that you don't like, that doesn't mean you can't do it, because there's always something else you can do to move. So without anything else to say, I'm going to turn it over to Melissa and let her do her presentation. And we're looking forward to hearing it. Melissa, thank you.
Okay, well, thank you, Lindy. Thank you for introducing me. Again, I'm going to talk about why cancer survivors specifically should be exercising. We're going to go through different types, and like Lindy said, there's always something that you can do. So I always tell people, find something that you like to do. So we'll go ahead and move into the presentation. I'm going to go ahead and share my screen. All right, so let's go from the beginning. All right, so let's go back. All right, so the title of, course, this presentation is Get Moving. So just like I'm saying, we want you to do something, just get moving. You don't have to do what anybody else is doing. Again, exercise is very specific to you. So we're going to go through that a little bit too, but let's kind of just go over overview. All right, so cancer survivors, of course, that's why you're tuning into this presentation. That's what you are. So there are over 15 million, if you can believe it, there's over 15 million cancer survivors in the United States today. And that's expected to increase to over 20 million by 2026, which is just in 6 years, we should be at over 20 million. So that's a good thing if you look at it, because why are, there's so many cancer survivors? Well, there's so many cancer survivors because there's early detection now. So people go in and get their mammograms early, they get their prostate screenings early, and you can catch that cancer diagnosis earlier than before. The diagnostic methods, the methods of, mammography and things like that are better. The treatment is better. So, now we're coming into all this immunotherapy. Before, the therapy wasn't as targeted. Now it is targeted. And so the treatment is better now. That your follow-up treatments are better. They're improved clinical follow-up. So, before, you're coming in more regular to follow up to catch, if you have a recurrence, to catch that recurrence. And then, the post-cancer healthcare programs, are more prevalent. So, of course, what I do, Cancer Fit, would be considered a post-cancer healthcare program. So, moving into that, exercise is very, very important to help reduce that reoccurrence, to help you live longer, survive longer after a cancer diagnosis. So that's why, there are more cancer survivors now. So that does pose a challenge, though. So it's because there are more survivors, now we're seeing the kind of the later effects of being a cancer survivor. So what does that mean? There's always a chance that the cancer can come back. That's a huge concern. So that's one challenge of a cancer survivor. You're always wondering, is my cancer going to come back? What's going to happen if I have a reoccurrence? I rarely meet a cancer survivor that just has cancer in their health history. That's it. They just have the cancer diagnosis. A lot of times you're dealing with diabetes, hypertension, high cholesterol, obesity, osteoporosis, all those things we call comorbidities, things that, other diseases that you're dealing with that's compounded at the same time. So not only do you have to deal with this, survivorship from your cancer diagnosis, you're having to deal with all these other diseases that you may be experiencing. And then, of course, just the effects, physical effects of cancer. So, you might still be having neuropathy from chemotherapy, that tingling in your hands and feet. You may very well be still dealing with the fatigue, that overwhelming tiredness. So remember that one, because we're going to come back to that one specifically. Weakness. Maybe you were sitting prolonged, bed rest for a prolonged period of time due to your treatment, and now you just feel weak. Joint pain, not only maybe with inactivity, you can have joint pain, but also sometimes the side effects of the medications you were given can cause joint pain, specifically some of the chemotherapy drugs. And just your overall quality of life. So socially, you may be different. You're not the same social person you were before you were diagnosed. Emotionally, it takes definitely an emotional toll on us. Physically, definitely physically. Remember, we talked about maybe being on bed rest, you're not moving as much. So physically, you're just different. And then just functionally, when I say functionally, just things that you do in your everyday life, you know, whether it be chores or just, you know, walking and doing shopping, you just functionally, you're not the same. So that's all that goes into your quality of life. And those are things that are challenges for a cancer survivor. So let's talk a little bit about the physical state of cancer. So now you're a survivor. Let's talk about what physically cancer did to you. So it caused that fatigue. Remember, that's bold. We're going to come back to that overwhelming feeling of tiredness. You can have a loss of coordination. Your heart, lung, and circulatory function may be reduced, and that may be just because you weren't as active during your cancer treatment. Because you weren't as active, you may be experiencing muscle weakness, muscle atrophy. That means your muscles have actually shrunk. They're not as big as they used to be, because when you don't use them, you lose them. Weight changes, whether that's weight up or weight down. We see weight changes with a cancer diagnosis, difficulty sleeping, all the other effects of cancer treatment, such as nausea, vomiting, and pain. So those are the physical things that cancer does to your body. But cancer is not only physical, it's mental as well. So what does it do to you psychologically? That mental fatigue, we sometimes call it chemo brain, or that brain fog. You just can't, you're not sharp as you used to be, you can't remember. All those other things as far as depression, anxiety, stress, all those things go into that mental. So, you know, you have a lot of anxiety because you're diagnosed with cancer. That can lead to depression. Of course, having all these appointments and things like that can lead to stress. Your body is not the same. So you have body image. You're not as confident as you used to be. So of course that, you know, your self-esteem is lower. And then you lose sense of control. You don't feel like you have control over your life because something happened to you that you didn't have control over. So those are what cancer does to you mentally and physically. So with that, one thing was common in those two things. It was the mental aspect of cancer, and it was the physical aspect, and that was the fatigue, right? So we saw fatigue in mental, and we saw fatigue in physical. So what is cancer-related fatigue? It's that overwhelming feeling of tiredness. You're weak, you don't have energy, and it's not just your normal tiredness. I worked all day, I went to the gym, and now I'm tired. We're not talking about that. We're talking about, I'm so tired I can't get out of the bed. I'm so tired I can't lift a remote if I had to. I'm just overwhelmed, tired. So it could be caused by the cancer itself, just having those bad cancer cells in your body, or it could just be a side effect from treatment. So a lot of times people say, well, I didn't have chemo, so why am I so fatigued? I didn't have radiation, why am I, it's everything. It's chemo, it's radiation, it's surgery, it's the actual fact of having cancer can cause you mental fatigue and physical fatigue. But let's focus in on the physical here. So I normally go by a fatigue scale. So as you can see, 10 is no fatigue. 10 means you can do whatever you want. You can run around the block, you can play soccer, whatever you want. Moderate is, I'm a little tired, but I can keep going. When you get to that 3, 2, 1, that's that extreme fatigue. You can't get out of the chair, or you are just totally exhausted. I can talk about that, but with exercise, we're trying to get you up toward more that mild, maybe moderate, but I always tell people, if you feel like that 1, that 2, it's better to just rest, because exercise is not going to really help you because you're just so low. So if you're at that point, then rest. And we'll kind of talk about how to deal with fatigue and how to exercise with fatigue in a second. So fatigue and quality of life. So like we said, fatigue is both physical and psychological. It occurs in almost 60 to 100% of patients undergoing treatment or diagnosed with cancer, and about 40% experience it months, even years. So it will get better, but I cannot say when it's going to get better. Everybody has their own baseline. A lot of people say the term new normal. A lot of people don't like that term because they don't want it to deal with a new normal. They just want to go back to their old normal. But you may have to deal with this fatigue ongoing. But 70% of cancer patient survivors say that fatigue significantly affects their daily routine and quality of life. So it is a huge factor in how we deal with the rest of our life, that fatigue. So we'll talk about the one way that I like to deal with fatigue. So traditional approach, psychological, they said, okay, there's cognitive behavioral therapies, there's psychotherapies, there's support groups, there's all these things to deal with that chemo brain. But when it came to physical, they just said rest, go to sleep, you'll feel better. But, as somebody who's dealt with fatigue, sometimes you can take a nap, you can sleep all day, and guess what? You wake up, you're still tired. So that's not the best. So the new approach, according to the American Cancer Society and the American College of Sports Medicine, that cancer survivors can benefit from regular to moderate exercise. I would say, if you think about it, if you've had a heart attack, where do a doctor recommend that you go? Probably some type of cardiac rehab, some type of program to train your heart to be stronger. If you have lung disease, they're going to say, okay, go to some type of rehab program, exercise to get your lungs stronger. If you have diabetes, they say exercise. If you have obesity, they say exercise. If you have you can see where I'm going with this. Any type of illness that you have, a doctor normally recommends exercise would help. Well, the American Cancer Society, American College of Sports Medicine got together and say, for cancer survivors, that should be the same. Just as we tell a heart attack patient to exercise, let's tell a cancer patient to exercise. So all the research, those two organizations got together and said, exercise does help cancer survivors. It significantly helps with fatigue. And we'll talk about that. So before it was treated with rest, now we're going to try to treat it with exercise. So the main thing is avoid inactivity. Try to be as active as you possibly can without dipping down too low, without tiring yourself out even more. So pace yourself. So I said all that to say pace yourself. So that is the main thing that we see with survivors. They don't pace themselves. And it's understandable. You spend weeks in bed, you spend weeks and months going through treatment, can't do anything and sick. So you're very, very low. So what happens when you get that one day or that 1 week or that one amount of time when you feel better? What do you try to do? You try to do everything that you did not do for the last weeks, the last month. And what happens? You do everything and you're back down low. So I have a little roller coaster here because that's what fatigue can feel like. It can feel like a roller coaster ride. It's only because we're not pacing ourselves. We have a day where we feel good, we do everything, and we're back down. So we're down for a couple of days, and then we start to feel better, and we get up here, and what do we do? Because we're up here, we do everything, and we go back down. So you have to get off that roller coaster. So do not overwork on days that you feel good, because you're going to sink back down. You'll go up and down, up and down. So break that cycle. Prioritize. If you have a good day, then do a little bit. If you have a good day, maybe just walk to your mailbox if you hadn't been able to walk to your mailbox. Don't, try to do 10 laps around the block, because then you're going to be back down and you're going to be in that chair, can't get out. So a little bit at a time. We have to pace ourselves. So physical activity can help you overcome fatigue, but you can't overdo it. So what physical activity does, it increases that baseline fitness. So, you may be here with exercise, your fitness will be here, so you won't sink down as low. So your endurance and strength becomes better, and work becomes easier because your muscles are stronger, and it makes you less fatigued. So that's what we're trying to do to combat that fatigue. So these are some of the tried and true proven benefits of exercise, not only for cancer survivors, but for everybody. So physically, what does it do? It improves your exercise capacity. That means you will be able to do more. You can walk further. You don't have to park in the parking lot and park far away and get to the store and be completely out of breath. You have a better baseline endurance. Your heart is stronger. It doesn't have to work as hard. You increase muscle strength, so you're able to do more. You can, maybe lift the laundry basket a little bit heavier. So it's going to help you in your everyday life. Your body composition, maybe your body fat percentage went down because your muscle mass went up. Fatigue, you reduce that fatigue, right? We talked about that baseline fitness level is higher, so you don't sink back so low, and your immune function is improved. So because that exercise helps with your immune function. Psychologically, does a lot for us mentally, right? So it helps you less mental fatigue, so less chemo brain, improves your quality of life. So we talked about all those social, emotional qualities of life. It helps you with that. Socially, you feel better. Emotionally, you feel better. Your self-esteem is better. Your stress, exercise is a great stress relief. Just kind of, if you're having a stressful day, if you can walk and kind of get your mind off of it, get the blood moving, it releases those endorphins that you feel better. Self-concept. So remember we talked about you feel better about yourself and your mood is better. You help with vigor, you decrease anxiety, depression, just because you feel better about yourself. So those are physical and psychological effects. So we always say exercise is medicine. It's one of my favorite sayings. Exercise really is medicine. We talked about, if you had a heart attack, if you had pulmonary disease, if you had diabetes, that a doctor will recommend you exercise. Because exercise is medicine. Exercise helps with all those things. It helps lower your blood pressure. It helps improve your cholesterol. If, your diabetes, it helps control your blood sugar levels. So not only does it help, we talked about the challenges of the survivors, all those other comorbidities. Exercise helps not only with the cancer survivorship and increasing your energy, but it also helps with any other illnesses that you may be managing. So, Melissa, you just said all this great stuff about, exercising. Well, tell me, how do I do it? How do I exercise? What do I do? Well, here you go. So we're going to start with aerobic exercise. Aerobic exercise is everything that gets your heart rate up, right? So your treadmills, your bikes, anything that gets your heart rate up, it moves your muscle in a dynamic movement is considered aerobic. So think about when you start walking, when you start running, when you start riding a bike, how your heart rate increases, that's considered aerobic exercise. So what are you supposed to do for aerobic exercise? So according to the American College of Sports Medicine, frequency, intensity, and time are what we're going to focus on. So they want you to get a total of 150 minutes of moderate intensity a week. So not a day. I know you're looking at that 150. How am I going to do it? Just a week. So you can break that down to 30 minutes, 5 days a week. Doesn't seem as bad. Now, remember, that's a end goal. If you're straight out of treatment, if you haven't been doing anything, that's an end goal. That's not a start goal. So if you only can do 10 minutes at a time, just do 10 minutes. Start where you can, but this is the end goal. This is their recommendation. End with 150 minutes of moderate intensity. They also give you the guideline for 75 minutes of vigorous, and we'll talk about the difference between moderate and vigorous. So of course, if you're working harder, they're going to recommend you do less. If you're working more moderate, I recommend that everybody work moderate intensity. It's just safer, especially if you haven't been exercising. So that's frequency, 150 minutes. Intensity is moderate. And then, of course, you can break that 150 down however you want, but that's per week. Type. So everything I said, you're walking, if you have access to elliptical, a rower, a recumbent bike, or just a regular bike. If you like group exercise classes, I don't know when we'll get back to that, but that was a different type. But of course, it depends on your cancer site, treatment, and surgery. So definitely, if you're experiencing neuropathy, that may be difficult walking, so you may want to choose a bike. If you've had a mastectomy and you have swelling or anything like that, you may want to limit, like if you're on an elliptical and moving your arms real vigorously. So of course, you do want to, if you need to consult with an expert or exercise physiologist or even your doctor, what's going to be the safest type of exercise for you. So we talked about how do you measure intensity. So remember, I zoomed in on moderate. So the one way to measure intensity is your heart rate. If you're healthy, if you're not on any heart medicines, what you can do is take 220 minus your age. So figure that out. And then you do 50 to 75% of that. That's where you should be working at. That's telling us based on your heart rate, that's how you'll feel moderate if you're at that heart rate range. Okay, so if you want to do that right now or write that formula down, 220 minus age, and then 0.50 times that number, and then 0.75 times that number, and that's your range. But I don't like heart rate as much, right? Because normally we do heart rate for healthy individuals with no problems, no medicines. But if you're on a heart medication, of course, that's not going to be true because that heart medication is controlling your heart rate. So I like to go more on the RPE chart, and that's that next one. So if you see 1 at the bottom is very light activity. That's anything other than sleeping, watching TV, riding a car. Really, you're not right now listening to me. You probably are 1. So if you look at 4 to 6 moderate, which I was talking about, it feels like you can exercise for a long time. You're breathing a little bit heavy, but you can hold conversation. We call it the talk test. So I can talk to the person next to me with little effort. So I'm moderate. I'm not working the hardest, but it's not easy. Like I'm sitting down. It's not even light. It's like, I feel like I'm doing something. So that's where you want to be when you're exercising. Vigorous is a little bit harder. So that was that 75 minutes. It's a little bit uncomfortable. Maybe you can't talk to the person and hold a conversation. Maybe you have to say a sentence and take a breath to say a sentence, but it's a little bit heavier. So I prefer you in that moderate activity, right? So talk test. I can talk to the person next to me. Maybe I'm sweating a little bit. I'm breathing a little bit heavier, but I can keep going. I don't need to stop. You don't want to be at 10. That's the max effort. That means you're about to pass out. You're turning red. You don't want to be at that point because you're not going to be able to sustain that for a long period of time. If you're more moderate, we can go a little bit further. We probably can do maybe 20, 30 minutes of activity at a time. And so that's what you want. So remember, you can use heart rate, you can use that formula, but I much prefer you do RP. It's very subjective and it's all of how you feel. And to me, how you feel is the most important thing, no matter what your heart rate, says. All right, so that's aerobic exercise. So let's talk about strength training. So again, the American Cancer Society and American College of Sports Medicine wants to do strength training. So you want to do 2 to 3 days a week. If you can do some type of strength training activity, you want to do 8 to 10 exercises, maybe 10 to 12 reps. So a rep is, if you're doing a chest press, a rep is just doing it one time. So you want to do 10 to 15 of those, 8 exercises. You want to make sure you pick up exercise for every major muscle group. But of course, this is the end point. If you start with just 1 exercise or 2, then you'll be doing great. You need muscle strength. So you need it for everything: cleaning, cooking, shopping, doing laundry, lifting grocery bags. So it is very important for our everyday life. So we talked about that quality of life that exercise is going to help. And if you can maintain your strength, it'll help you remain independent for a lot longer. There are some limits, so you do want to be aware, again, of surgical sites. Always ask your doctor or exercise professional. You may have weak areas associated with chemo and radiation, so be careful of that. Skin care, so from radiation, you may experience burning, things like that. So, of course, if you have that, then you want to stay away from those sites. And then ports. If you have a port implanted, I always tell people be careful of chest exercises because if you're still going through treatment, you really don't want anything messing up that port. So always talk to your doctor if you have anything like that before you start strength training or any exercise program to make sure it's safe. Next. All right. So again, stretching is important as well. So you do want to do stretching exercises. Try to stretch all the major muscle groups, but especially the ones that you're working. So if you're, walking a lot, you definitely want to make sure you stretch your legs. If you're doing any upper body exercise, stretch your upper body. If you can find a great chair yoga or gentle yoga class, that's even better because that helps with range of motion and flexibility. Relaxation is very important too. Helps deal with stress. I mean, a lot of times we know we focus on aerobic, definitely strength, sometimes flexibility, but that relaxation gets left out. And that's an important part because that guided relaxation or just deep breathing that you get in yoga classes can help with anxiety, depression, and stress, which are, remember, challenges of the survivor. So we talked about aerobic, we talked about strength, flexibility, and relaxation. So that's a very good, well-rounded 4-tier exercise program if you get all 4. But just start somewhere, right? Okay, all right. So goal setting. So I have to touch on goals because sometimes if we don't set a goal for ourselves, we won't do it, right? So sometimes if we just say, I'm going to start exercising, but we don't have a specific goal, it's going to be harder to do it. So, just having some type of goal helps us stick to something. So it could be simple. Like on here I have, those have to be SMART, and each letter means something, but they have to be specific. So clear and precise. This one says walk on the treadmill for 30 minutes, 3 days per week, but we don't even start that. Again, if you're really deconditioned, I always say, I'm going to walk to my mailbox twice a day. That could be a SMART, specific, clear, and precise. I'm going to walk to my mailbox once a day. Or I'm just going to walk around my house, my apartment once a day, maybe twice a day. So you want to be specific, set a goal for yourself to start, because if you don't set that goal, sometimes it's hard to start. So have a goal. Make it measurable. So something that you can measure specifically. That allows you to track your progress. I want to be able to exercise for 20 minutes, 2 days a week. So I can measure it. So that way I can make sure I'm making progress. And even if you wrote it down, say, oh, I started with 20 minutes, now I'm at 30. So something that you can measure. It has to be action oriented. It makes you do something. I'm going to walk to my mailbox. You know, if you can't just, you have to be specific, and it has to be action oriented. It has to be realistic, you know. It goes without saying, right? I'm not going to say, you know what, I'm going to lose 50 pounds this month. I mean, that can be done, but is that really realistic? So just small, little, simple, small, realistic. I'm going to, again, walk to my mailbox twice a week. That's very realistic. I can do that. Simple, easy. Make sure that you don't have this big, hefty goal that you cannot complete. Do not set yourself up for failure. A lot of times people do set themselves up for failure. An example is, you know, when you're setting a goal and you're specific and you're not being realistic, it has to be very specific to you as well. If I know I'm not a morning person, and I say, oh, you know what, I'm going to get up at 6 o'clock every morning and I'm going to walk in my neighborhood. If I'm not a morning person, I'm really setting myself up for failure, because I'm like, there's no way I'm going to get up at 6 in the morning if I'm not a morning person. So make it realistic to you. Maybe I'm at 2, I'm going to walk to my mailbox. This is something very specific, realistic to you. And then give yourself a time. And, you know, a month, I'm going to be able to walk 2 laps, 2 blocks. Okay, so that's measurable. You know, that way you can make little progresses to meet it. But remember, it has to be realistic. If you're, you know, barely walking to the kitchen right now, then, you know, maybe walking 2 blocks is not the best goal for you. So again, it has to be time, but realistic. So goal setting just helps you stick to a plan. So, you know, it's not absolutely necessary, but it does help. And remember, no one size fits all. Exercise is very, very specific to you. Like Lindy was saying, there's something for everybody. If you hate walking, well, don't make walking your exercise. Maybe try a bike. If you hate bikes, make walking. If you like to dance, I love to dance. If you like to dance, say, you know what, I'm going to dance. I'm going to put on my favorite song and I'm going to dance for 10 minutes. That would be your exercise. So there's no one size fits all. Everybody is different. Everybody's different. So you, just like when it comes to goals, you have to be very specific to you. So that's all I always say, you know, try to find something fun. I know exercise isn't the best. A lot of times we do not like exercise, but if you think about, okay, you know, I enjoy outdoors. So, you know, getting outside doing something helps, you know, doing yard work, anything that you can get your heart rate up. If you're not an outdoors person, well, I'm not gonna, you know, I'm gonna stay inside. Maybe I'll, you know, invest in a treadmill or a bike or something that I can do inside. So there's no one size fits all. Think about yourself, think about things that you like, think about your capabilities, and then you just go from there. And that's it. One last thing, I do talk about lymphedema and exercise, just a short thing. A lot of times I get a lot of questions, and if you have any questions, remember, as we went through this, write them down, and then we'll talk about them when I'm there virtually on that Tuesday. But lymphedema, I do get a lot of questions about that. All the research shows now that exercise did not exacerbate lymphedema. So you do want to listen to your body. Lymphedema is that swelling in your extremities. A lot of times for breast cancer survivors, it's that loss of that lymphatic system because you've had lymph nodes moved and you don't have that pumping action as well, and it pulls in the extremities. You can exercise, but you do have to go slow. You can't overdo it. You do a little bit at a time, and then you move on from there. And again, if you have any questions about things like lymphedema and exercise or anything that's very specific to your type of cancer, and you've had questions about, is this safe? Remember, write those down and we can talk about that. But that's a very specific one that I get a lot. Is it okay to exercise with lymphedema? Definitely, if you have a sleeve that they've prescribed for you, do not exercise without your sleeve. I cannot stress that enough. I've had that happen so many times. Do not exercise without your compression sleeve. That would be. Now, so to sum it all up, try to be active at least every other day if you can. If you can't, 1 to 2 days a week, do something. Try to build up to 30 minutes a day. Start with 10 minutes and slowly work your way up. That's that SMART goal specific. Start slow, progress slowly. Moderate intensity, we talked about that. Choose something you enjoy. You want aerobic, resistance, flexibility, remember relaxation. And then even the modest amounts, even a small amount are beneficial. So a brief walk, so anything that you can do is beneficial. So you gotta start somewhere. So just start. And now that is it. So I'm gonna stop my share on my screen. And remember, if you have any questions, you can write those down. That's it.
Thank you so much, Melissa. That was so exciting and so informational, and you are so full of energy and excitement. I just love it. Everybody, keep in mind that Melissa will be with us at our next meeting. So write down any questions that you have ahead of time, and also dress comfortably, so because she will have some form of an exercise for us to surprise us with. So we're looking forward to that. And just remember to, if you have any questions or anything you need before we meet, you can email those to me. But we look forward to seeing you all on Tuesday night. Thanks again, Melissa, so much for being with us. And we look forward to seeing you
I
Tuesday.
enjoyed it. Look forward to working with you guys.
All right, great. Thank you.